name is David. I am a geriatric advanced trainee in Perth, Western Australia, and today I will be demonstrating the use of the REMAP communication framework that can be used when approaching a goals of care discussion with a patient or surrogate decision maker. The goals of care conversation is a discussion with the patient to determine what their goals and values are, and then align treatment recommendations that are consistent with those goals and values. Having these discussions can be challenging, but it is a key step in determining what treatment best aligns with the patient's goals, especially among those with life-limiting illnesses. It has been observed that when these discussions occur earlier in a patient's hospital admission, patients are exposed to fewer non-beneficial medical interventions, less CPR near the end of life, and shorter inpatient length of stay. Clinicians report a lack of training in conducting difficult conversations with patients and often lack confidence in their communication skills. A fear of stirring up emotions, which may be difficult for clinicians to respond to, can be a barrier to initiating goals of care discussions with patients and their family members. Several studies have found that having these conversations does not increase psychological distress or rates of anxiety and depression among patients. It has also been found that patients are generally interested in discussing their goals and values, but often assume that their healthcare providers are already aware of their preferences and values. For this reason, clinicians will benefit from having a framework with which they can approach these challenging encounters to ensure that the patient's needs are met and their emotions are responded to. The REMAP framework, developed by VitalTalk, acts as a talking map to help clinicians navigate these challenging situations. The processes underlying REMAP encourage clinicians to remain flexible and adapt their medical recommendations to the goals and values that the patient conveys, promoting shared decision-making and better end-of-life care. The first step in the process is to encourage the patient to re-evaluate their illness trajectory by providing a big picture headline that lets the patient know things are in a different place. This involves assessing the patient's understanding and providing a medical view of their current situation. It is not necessary for the patient to accept the medical perspective to continue, but their view should be explored. Firing a warning shot to prepare the patient can be useful, such as, "Is it okay if I tell you what I am worried about?" Useful phrases to begin these statements can also include, "I hear, I hope, I'm worried." Emotion usually follows the reframe and should be expected. The clinician should actively attend to the patient's emotional response, which may be verbalized, but be on the lookout for nonverbal cues. The nurse's mnemonic can be used to respond to emotional cues. Firstly, name the emotion. Then acknowledge that you understand correctly what the patient is feeling. Take a moment to respect and reassure the patient and provide a supportive statement. If necessary, explore the emotion further, as there may be multiple feelings that the patient is trying to express. Silence, when used appropriately, can be useful after any of these steps. When eliciting a patient's values, focus on asking open-ended questions that will help the patient think about which values should guide their treatment. This can be done by asking patients directly what they value, or you can lead into the conversation by asking what life is like outside the hospital, or what they would like to avoid if they were to get more unwell. Patients will have a set of values which can often be complex. The task is to explore these, feed them back to the patient, and then help them to prioritize them. In aligning, the clinician reflects back to the patient what they have heard, and then confirms that they have understood the patient's goals and priorities correctly. The patient may take this opportunity to clarify, expand, or qualify what is important, in which case further mapping may be necessary before making a recommendation going forward. Finally, propose a medical plan that matches the patient's values and goals, with consideration of which medical treatments will help the patient to achieve these. This recommendation will depend on the patient's goals, the degree of risk they may be willing to accept in achieving them, and the feasibility of specific treatments. When explaining the plan, it should be explicitly linked to the patient's goals. Complete this step by then asking what the patient thinks of the plan and if they have any further questions. I will now demonstrate the REMAP framework in action. The following scenario is a goals of care discussion with Janet, the daughter of our patient Anne, an 80-year-old woman with a background of dementia who is still living at home alone, relatively independently with appropriate supports. Anne has been admitted to hospital with an acute respiratory illness and has been diagnosed with COVID-19. In this scenario, I will have a goals of care discussion with Janet acting as Anne's surrogate decision maker.
Hi Janet, thank you for coming in. I'm David, one of the geriatric registrars looking after your mum, and I appreciate you making the time to come in and speak with me about her. Before we get started, I just want to make sure that I've got all the details right. Can you tell me what happened?
Yeah, so my mum's been living by herself for a few years now. She's been coping really well living by herself. She gets a bit of help because she's got dementia now she's starting to slow down a bit. So she was diagnosed with dementia last year, and she's 80 now. So we came in because she started having a little bit of a cough the past couple of days, and then she had a little bit of trouble breathing. So I called the ambulance just to get her to come in and do a checkup, and a doctor said that she has COVID. So, I'm hoping to ask you a few questions on how she's going and how long until she's better and can probably come home.
Sure. So we can talk about that a bit more. As you've said, she came in with a cough and some trouble breathing, and she's been in hospital for a couple of days now. And when we did the test for coronavirus, it came back positive, so she does have COVID-19. We checked the oxygen levels in her blood, and they're actually quite low. So we've had to start her on some extra oxygen through a mask at the moment, just to help get the oxygen levels up. But it definitely looks like the virus is affecting her lungs and how she breathes and how she gets oxygen into her blood. So while we do hope that she gets better and that she'll get home, we are worried for her at the moment that she is becoming a bit more unwell. And what we need to talk about now is about your mum and who she is and what's important to her, and then we can make a bit of a plan about what we should do next for her.
I'm very upset by this diagnosis. I can't lose her. She's only 80 years old. I'm not ready for her to go, and I don't think any of the family is ready for her to go. I mean, is there any medication that you could give her, or does she need a ventilator that can make her better? Because I'm really anxious that she's going to be in pain.
Sure, we can talk about that a bit more later, but first of all, yeah, I can see that obviously it's a very uncertain time, and you're feeling quite anxious about your mum and worried for her. Is there anything else that you're feeling at the moment?
Oh, I just feel a little bit stressed about how I'm going to look after her, and making sure that she's not in any pain. And I guess I'm just really frustrated that I can't do anything more to help her. I'm a little bit angry that it's gotten to this position because we were so careful about her leaving the house and staying at home.
Yeah, I can definitely appreciate. It's understandable that taking precautions and still she's gotten sick. Definitely a very difficult thing to have to manage, especially given she's become unwell so quickly. And it sounds like she was going along pretty well before all this happened. Um, uh, we'll just let you know that we're here to support you as well as your mother while she's in hospital, and if there's anything we can do to help you as well, let us know. Can we talk a bit more about your mother as a person, and just to find out a bit about what she values? What does your mum enjoy doing when before she came to hospital, and how does she tend to spend her time?
Yeah, so my mum really liked being outside in her garden and tending to her roses, and she really likes cooking, and she's got a good group of friends, and they kind of all meet up and watch TV together and eat meals. So she's really quite quite independent. She really likes being able to do things by herself, and be a little bit self-sufficient.
Okay. So yeah, what I'm hearing is that your mum enjoys her independence and likes her gardening and catching up with the friends and family and being able to do those things where she's able to look after herself without a lot of assistance from other people. When you've spoken with her in the past, are there any things that she said that wouldn't be acceptable to her if she became very unwell, or things that she would be anxious or worried about if she was in hospital?
Yeah, so I guess she's was always very concerned that she would be in a lot of pain, that she'd be stuck in the hospital for a really long amount of time, and kind of dependent on machines, and just not be able to look after herself, or not be able to live in her home, but having to be sent to a nursing home. She wasn't very, she just didn't want to live her life that way. And yeah, she said to me before that if she was very, very sick, she just wanted, I guess she wanted it to be peaceful, and she didn't want to be, on any machines and in pain.
Sure, thank you. That's all very helpful. It's obvious that you know a lot about her, and it sounds like she's been very clear with you that she wouldn't want to be in a nursing home, and that being comfortable is important to her as well. Um, if the goal is to have mum being as independent as possible and at home for as long as possible, we would hope that she gets better very quickly, while she's getting the oxygen and the antibiotics at the moment. If she were to get more unwell though, needing more oxygen, or despite the treatment that we give her, it might be that she would need to spend quite a much longer time in hospital in order to get better. And if she did get better, it may be that she's not able to continue living at home, and maybe needing a lot more assistance to live, potentially even requiring care in a nursing home. It sounds like, from what you're telling me, that maybe those sorts of things wouldn't be acceptable to your mother.
Yes, that's correct. I think she would really struggle, not being able to do stuff for herself and look after herself, and I don't think she would want to be in a nursing home, and be unable to, I guess, be in her house, and be able to garden and do all her things independently, which she was doing before.
Okay. So I guess the best thing I think to do for her at the moment would be continue to support her, giving her medication, including the antibiotics, just in case there's a bacterial infection as well that might be making her on top of the more unwell on top of the coronavirus infection, and then also medication help keep her comfortable, making sure that she's not in any pain, and that her breathing's comfortable as well, and continue to support her. And then, while we hope she will get better over the next few days with this, we'll also be keeping a close eye on her and looking for any signs that maybe she's still not able to get enough oxygen into her lungs. In which case, maybe keeping her comfortable may be where we shift our focus more. And it sounds like that she made it very clear that she wouldn't want to be attached to ventilators or be having a lot of procedures done to help that may make her more uncomfortable rather than help her actually get home to where she wants to be. Does that sound like a reasonable plan?
Yeah, that sounds like that would be what she would want, just to be comfortable and still retain some of her independence.
Sure. Are there any questions that you had for me?
No, I don't have any questions. Thank you for your time.
Great. Well, if it's okay, maybe we'll go see her now and we can have a talk with her about what we've discussed.
Yeah, that'd be great. Thank you.
Thank you for your time.
In summary, the focus of goals of care discussions should be on patient values, not specific treatments or procedures. By focusing on key goals, it allows the patient to retain a sense of purpose and control, which can be an antidote to the hopelessness and despair that can arise in serious illness. These conversations will stir up emotional responses among patients, but acknowledging and responding to the patient's emotions is an important step before proceeding with the discussion. To become an expert in using the REMAP framework requires practice. REMAP is designed to be flexible, and with experience, the steps can be blended into a free-flowing conversation. Remember phrases that you used that were effective in achieving the desired outcome in a discussion. There is no one-size-fits-all approach to these conversations, and all patients and discussions will be unique. By having different ways of phrasing questions and responses, you will be able to navigate the patient skillfully through the shared decision-making process. Seeking out experienced clinicians to observe and learn from will help you to develop your own skills. For further information and training on the REMAP framework and goals of care discussions, please visit the VitalTalk website. Thank you for watching. If you have any questions or feedback, please post these in the comments section of this video.